how to make patients Bhishak Vashya, or what is Bhishak Vashya, and how there any tricks to make the patient Bhishak Vashya?
Definitely. See, when I do consultation and even after the consultation, so I give my time. I believed in giving time. So as Dr. Hebar also knows, so he keeps telling me, see, do it as simple as possible or go according to the time. So because we have a lot of time and other things, many times I overdo and over cross the timings also. So that is not only the plus point. So spending the time to the with the patient hearing first of all, and allowing them to explain, not moving with the emotion, but getting connected with the emotion of the person. So when we remember a scene from one of the super hit Hindi movies, Munna by MBBS, there the dean tells, treat the patient as a subject. That's all. Don't get emotionally connected. No need of getting emotionally connected. But on the other way, see, our approach towards the patient should be such that the patient themselves will get emotionally connected with us. So half the healing shall be done. Last couple of consultations, what I have done, I have not even prescribed a single medicine, and the patient are so happy. Not even prescribed a single medication. I just suggested the lifestyle changes, and these things need to be done. And you people are overthinking or overdoing these things. So recently, yesterday or day before yesterday, one of my patient wrote. So the recent consultation wrote that the doctors were just trying to push me some medications and trying to what sell themselves. But you did the right thing, doctor. After a couple of years, I found really happy that you did not mention a single medication. You just suggested me to follow 1.5 months of at least 50 days of what you said, and I'm already started feeling better after speaking to you. See, this if we can get it into the minds of the patient, speaking to the doctor should be like speaking to a friend, and the counseling part should be really good. Speaking to the, be it a small condition like a rhinitis or a fever or a very chronic conditions where we know that we cannot do a lot, but we can help to a particular extent. So this is very much essential, especially when the patient is out of India and out of reach of Ayurveda. Ayurveda doctors are not available there, and shipping the medicines also will be very difficult. I always believe in three principles: Charaka, Sushruta, Vagbhata. So these things are very, very important. Charaka is exploring. I keep telling, Charaka means Chara, explore. First of all, the physician should explore into the theory, explore into the minds of the patient, into the emotions of the patient, try to gather as much of information as possible. So be a Charaka first, explore. So in my clinical practice, what I do, for most of the conditions, I don't do a immediate prescription. So I take time, understand the case. So though with more than 25 years of clinical experience, I handle every case as a new case and a fresh case. So what I do is the Charaka concept. So Chara, I explore it into depth. How is this patient different from the other patient? So there are general principles of treating Samanya Chikitsa, we have discussed many times, and specific. So here we are speaking about the personalized approach. The patient will be very happy with the personalized approach. Know the patient by name or the client by name. Next time when they email or when they come for a follow-up consultation on the whether it may be the e-platform or email consultation or online consultation, or directly you are seeing the patient. When I address the patient by name, there itself half the problems are gone. Okay, doctor remembers me. Doctor remembers my problems. I may not remember all the problems, but if I can remember those small things related to that particular client, it is very difficult, but that will really help. So be a Charaka first, then be a Sushruta, patient hearing. Sushruta, there is Shruta. Have a patient listening. Collect all the information. Don't meddle with the patient. Let them express whatever it is there. They have set of complaints, 100, okay, and we should bring that 100 symptoms, the summary, shortlist it and bring it to what we want and how we are looking at it. Very important. And then Vagbhata. After that, walk. So I have the authority to speak, to advise, to give the prescription. So by doing all these things, I think it is not a rocket science. So here it is very important how we get connected at the first instance. First instance is very, very important. Love at first sight is true with the patient and doctor also. That compatibility development is very important, that getting connected is very important. Nowadays, the prescription is already ready. The moment the patient comes into the clinic, I have seen personally my elders taking them to cardiology centers. I don't want to just blame any other science or anything. So they don't have time. By the time we enter inside, we have so much of waiting time, like waiting for 2 hours, maybe 1.5, 2 hours for an expert, and then going in and just submitting those records. They'll say, okay, how is your complaint? Okay, done. So continue these medicines, +1 or -1 is done, over. So there is no connect. The patient will go and continue those medicines and come back after 1 month. So that is not how we, and very important is get the patient involved. The P4 medicine, I think Dr. Rebbar, once we should have a session on P4 medication. So very important. So here P4 is personalization, predictive medicine, personal medicine, and very importantly, the fourth factor comes is the participatory medicine. Participatory. Let the patients participate. Let the clients participate as a festival. Their healing is the festival. Nobody knows the patient better than a patient themselves. They are the masters. I can know about a patient only when he or she tells me, but they will know A to Z about them, how they can do, what they can do. So very important is customizing the medicines, customizing the advices, customizing the diet protocol, lifestyle activities, exercise, everything as it suits them. We also need to see mano ahladakara. So like when we please the patient or the person and we put all these treatment protocols in a comfort zone where they can take, which differs from person to person. So it will be, I think, superb. So there are so many techniques. So I think over a period of time, I learned to give time to the patients. So patient and patients. So these two are very important. Both should have. The doctor should have the patients. Patient should also have the patients. And the Chikitsa Chatushpada should work out. All those four limbs should work out. So a better talk, a better interaction, better communication, better follow-up, and keeping the link and allowing the patient or the client to participate in their healing process is very important. So they will be really happy to get connected to you. And I tell my patient or the client that they ask me, when do I come for the next time? I tell them, why do you even come the next time? This is not a picnic. This is not something, a theater. You come and enjoy a show. No, you believe in yourself. After this consultation, keep a target. Within next 30 days, I'll start getting better. I always, one advice definitely I'll give my clients. If your arthritis is in the knee, I can treat you. If your arthritis is in your mind, nobody can treat you. You are the best person to do that. Okay, allow the problem to be where it is, and we will handle it from there itself.